Dr. Schierholtz. Appreciate your testimony. Dr. Toussaint.
Good afternoon, Chair Warren, Ranking Member Kennedy, and members of the committee. It's an honor to be here, and I thank you for inviting me to discuss my experience with non-compete agreements from a doctor's perspective. My name is Will James Toussaint, and I'm an orthopedic surgeon at the University of Florida as of 2022. And I'd like to state for the record that the opinions expressed herein are my own and do not reflect the positions of UF or UF Health. I was born in Haiti and immigrated to Florida, where I achieved the American dream. I was the first in my family to be accepted to college. I worked on Wall Street after college to pay off my student loans. I was then accepted to medical school, where I graduated among the top of my class, and as a result, I matched at Harvard University's orthopedic surgery residency program and then completed an orthopedic foot and ankle fellowship. In 2014, I joined a private practice group in North Central Florida as their only foot and ankle trained orthopedic surgeon. I was one of only 2 surgeons with this expertise across a dozen mostly rural counties, serving over 850,000 people. Over the next few years, my partners and I felt the pressures of decreasing reimbursement coupled with the burdens of pre-approval requirements from insurers and competition from other practices. We felt that an infusion of capital was necessary to remain sustainable. As a result, we entered into a purchase agreement with a private equity company headquartered in California. The deal closed in 2017. Although I cannot disclose the transaction's details, there was indeed a non-compete clause. Per the non-compete clause, I would be restricted from practicing orthopedic surgery within 25 miles of any facility in which the group was currently providing medical services, any facility in which the group had previously provided medical services, any facility in which the group was targeted for expansion within the entire state of Florida, and any facility the group was in discussions with related to a potential acquisition. This non-compete was valid for 2 years, and of course, the group was located in multiple states.
This is an explosive first-hand account of how non-compete agreements and private equity are affecting healthcare in America. Dr. Rue Tanth reveals the shocking reality behind his experience as an orthopedic surgeon, serving over 850,000 people, and the legal battle that nearly cost him everything. This is what they don't want you to hear. Hey, don't forget to like this video, subscribe for more powerful stories, and comment your thoughts below, and, hit the bell so you don't miss the next deep dive. What if I told you that saving lives could come with a legal price tag? That the very doctors we trust are being boxed in by contracts designed to control their every move, even after they quit? Today, we're breaking down the real story of Dr. Rue Tanth, a Harvard-trained orthopedic surgeon who fought back against a system designed to silence him. His testimony in front of the United States Senate is more than just a personal account. It's a wake-up call. So let's dive into one of the most eye-opening stories about non-compete agreements in healthcare you'll ever hear.
Unfortunately, within months after closing the deal, the morale of the physicians and the staff declined. Instead of cost savings, the practice's overhead expenses increased significantly due to more layers of administrators, excessive management fees, and millions of dollars of debt expenses. The overhead increased so substantially that some physicians not only did not receive a paycheck, but actually paid to work, despite the physicians taking on all the risks of patient care. All the while, the cost of the patients started to rise, and they complained that their quality of care decreased. Personally, I became disillusioned by management focus on dollars instead of the quality of care. I eventually put in my resignation stating my intent to leave for academic practice at the nearby nonprofit public institution. This decision made sense given that the only other orthopedic foot and ankle surgeon in the entire region was retiring, and I would be able to help educate the next generation of doctors. Despite this, the private equity group filed suit against me.
Dr. Rue Tanth was born in Haiti and immigrated to the United States, chasing the American dream. He crushed every challenge in his way: Wall Street analyst, NYU med school, Harvard residency. By 2014, he was the only foot and ankle specialist serving over a dozen rural counties in Florida. Then came the catch, the hidden fine print. A private equity firm came knocking, offering the group a lifeline, but that lifeline came with a non-compete clause so massive, it nearly wiped out access to care for an entire region. Imagine signing a deal that says, you can't work within 25 miles of any place we work, have worked, or might work, anywhere in Florida. Oh, and it's valid for 2 years. That's what Dr. Tanth signed, but here's the kicker: he didn't even know the full scope of that clause until the deal was already done. By then it was too late. These clauses don't just trap doctors, they strip communities of care, but it gets worse. After the deal closed, expenses skyrocketed, patient care plummeted, and morale hit rock bottom. Doctors weren't getting paid, some were actually paying to work. Dr. Tanth realized the focus had shifted, from healing to profits. He decided to walk away, to serve at a nonprofit university hospital.